The COVID-19 booster shots are coming, and not without controversy.
This is turning into a bigger mess by the day, unfortunately.
But it does feel like the entire country is kind of walking around trying to figure out when to get their boosters.
So clearly the fate of the economy is tied to this virus.
Here's where we stand in the fight against the Delta variant, in the booster shot debate, and how we got here in the first place. The Delta variant first popped up in India in December 2020. Back then, it was known to scientists as the B16172 variant. Now it's the dominant variant in more than a dozen countries.
The local officials have described the variant as alarming.
Very worrisome because this seems to be more contagious and more pathogenic. It does seem to be a more dangerous variant.
She says Delta now is the second most prevalent variant here in the United States, and in the coming weeks, she predicts it will eclipse the Alpha variant. That's the B117 variant first identified in the UK.
This is now in New Jersey a pandemic of the unvaccinated.
It's more than 60% more transmissible than the original coronavirus. Symptoms from the Delta variant remain largely the same. Coughing, trouble breathing, suddenly losing your sense of smell or taste. But doctors have been reporting that people infected with the Delta variant have been getting sicker and more quickly than those with the regular coronavirus. Delta also appears to hit younger patients harder than the original strain. What's worrying people the most, though, what's causing companies to scrap return-to-office plans and mask rules to pop back up, is Delta's ability to break through COVID-19 vaccines.
What we think's happening is that Delta creates such high viral loads early in the course of the illness that if you have declining levels of circulating antibodies, it can overwhelm your initial defenses. It can overwhelm those circulating antibodies. You get infected, and then you're dependent upon secondary immune cells, you and I have talked about, like memory B cells and T cells, to kick in to then fight that infection to prevent you from getting sick from the infection. But it takes a couple of days for those secondary immune cells to kick in. So in the meantime, you've been infected, you might be developing mild symptoms. Eventually, those immune cells will kick in, and those cells will prevent you from developing severe disease, from being hospitalized, but you'll qualify as someone who's become infected with COVID at that point. So this is really the debate among the public health crowd, because what they say is maybe we don't need boosters because the vaccines are still doing their job in terms of protecting people from getting hospitalized and developing severe disease.
For the unvaccinated, the Delta variant remains extremely dangerous. For the vaccinated, it gets a bit more complicated. No vaccine has ever been 100% effective. The mRNA vaccines from Pfizer and Moderna came close. Both vaccines surprised everyone with how effective they were, both in the mid-90th percentiles. That's against the initial strain of the coronavirus, however. Against the Delta variant, the efficacy dropped. One study showed that the 2 doses of the Pfizer vaccine was 88% effective against the Delta variant. Still, based on the latest data, that means a fully vaccinated person has a very, very small chance of getting infected by the Delta variant. And when they do, they're still much more likely to avoid getting seriously sick or hospitalized. Here's where we stand with the booster shots from Pfizer, Moderna, and Johnson & Johnson. Right now, the CDC recommends that people with compromised immune systems should get a 3rd shot of Pfizer or Moderna vaccines at least 28 days after their 2nd dose. The CDC and FDA are still weighing evidence for rolling out booster shots for the rest of us, about 8 months after the 2nd dose of either mRNA vaccine. Pfizer's booster shot could be ready by September 20th, the previous deadline set by the White House. Moderna's 3rd shot might not be ready by then, according to White House medical advisor Dr. Anthony Fauci.
It's one of the reasons that we believe the boost works is that you give the immune response of the 2nd shot enough time to mature and make it ready so that when you give a boost, it really jacks up the response a lot. So you don't want to make it too soon, but there will be a range of when you can get it, even though optimally we'd like it to be 8 months. I believe people are going to be doing it at 6 months or so. Human nature itself is going to tell you that people will be doing that.
A booster from Johnson & Johnson would likely come later, since the initial 1-dose vaccine didn't roll out until 70 days after the other 2 vaccines. So where's the confusion coming from? Some health experts feel there wasn't enough data for the White House to announce booster shots, and regulators like the FDA and CDC still need to approve them. The FDA is meeting on September 17th to discuss Pfizer's booster.
the political pressure essentially to come out and say we need boosters and we're going to start making them available September 20th. And then, of course, there's a caveat in that line from the administration and all the administration's health officials saying pending the FDA's review of the boosters and making them available through the normal regulatory processes. But this is essentially backwards. Normally what happens is it goes through the FDA, then it goes through the CDC. But here you have the White House leading the charge saying we need boosters. We're going to start making them available September 20th, as long as the FDA signs off. And that's the pressure that people are worried about.
Getting Americans to receive full doses of COVID-19 vaccines proved to be a challenge. As of early September 2021, only about 53% of Americans were fully vaccinated, according to the CDC. Vaccination rates in other countries, in poorer regions of the world, remain much, much lower. The World Health Organization wants Western countries, like the United States, to slow down with its rollout of booster shots.
Some countries are now rolling out booster doses to fully vaccinated people, when millions of people around the world have not even received their first dose.
Before the Delta variant, life was getting pretty close to normal. Now, not so much. The Delta variant caused one company after another to scrap their return to work plans. It's also eating into the economic recovery. And now the White House has a new plan to fight COVID-19.
We remain at a critical moment, a critical time. We have the tools. Now we just have to finish the job with truth, with science, with confidence.
The White House wants to do the following, plus a whole lot more. It wants to require all businesses that employ more than 100 workers to make sure their employees get vaccinated, or at least get tested weekly. It wants all federal workers to get vaccinated, along with millions of contractors that work with the federal government. It's also calling on all states to have every school employee vaccinated.
But while America is much better shape than it was 7 months ago when I took office, I need to tell you a second fact. We're in the tough stretch, and it could last for a while.
There's another COVID winter coming, and no one is quite sure what to expect.
Are we going to need boosters every year, indefinitely?
You know, I don't think we can say that. I doubt it very seriously. You know, I believe that the third boost of a 2-shot regimen, namely what we're recommending for those who've gotten the mRNA vaccine, we're noticing in clinical studies that the level of antibodies that induces is very, very high. So what we're hoping for is that third shot really gets you up to such a high level that not only is it highly protective, but it's very durable.
And so it's just evolving. We're in a state of evolution, and the booster shot is the next phase. And like everything else we do, we're going to prejudge and pre-worry and get concerned about it. But if we just let things take its course, and we'll see how things go and progress with the change of season and going into the fourth quarter of the year, my guess is there will be a requirement for the third shot for the booster, just like there was for 2 vaccine shots. And the companies that want to be vaccinated only will stay that way, and they'll include that codicil. And the ones that don't, won't.
The only way that we'll get a hold of this virus or control it is if companies, employers get in the mix and begin to mandate the vaccines, especially now that the Pfizer one has been fully approved by the FDA. This is important, especially as we think about the return to work policies. We need to make sure, and employers need to make sure, that everyone feels safe, and the assurances can only come if you have high rates of vaccinated employees.